Now, okay, now we are going to talk about the suicidal ideation session. And it is a very difficult station because you see that the approach is not the conventional approach, and what you are going to say to the patient is different from what we are used to say to our patients regarding the management. Okay, but pay attention to the scenario because it will give you a lead about what's going on in this station. As you can see that this man has been in contact with the psychiatric services before. You can take screenshots about for this scenario. Some candidates thankfully gave me the new notes. So this man has been in contact before with psychiatric services. He's a driver, 43 years old. And for 10 years, he has been experiencing these thoughts which come and go, last for 4 to 6 weeks, and gradually they abolish over 4 to 5 days. And there is no particular triggering factors. Other than this, everything is okay in his life. He's a driver. There is no other stresses. There is nothing exactly. And pay attention that they don't want you to take history or examine his mental state or inquire about the treatments in order to save time, and please stick to your task. Stick to the task. All what they want to do is, are you able to formulate a safety plan for this serious complaint? Okay. So in the beginning, what you should do is that you should carefully organize your 7 minutes. You should have a good plan. You only have 7 minutes. It's not, the situation is not like what you do in your clinic. So we have our introduction, we will gather some information, and we will explain some factual information related to the topic of the station, and then we do our formulation and finally the management. So in the beginning, you should introduce yourself. It is part of your task to introduce yourself. An introduction, it is one of the communication skills. Do not underestimate it, please. And though I always say this, but still some candidates forget or they don't practice how to introduce themselves. They struggle in how they address the patient. Sometimes they don't identify themselves. Sometimes they don't explain the reason for the setting. So the introduction is simple. Greet the patient, introduce yourself, and explain why you are talking with him. And then the second stage is to gather the information which you want to know. So you want to know exactly what are these thoughts. You want and to have some examples. So give me some examples about these thoughts. Okay, what makes them increase? What makes them decrease? Okay, we know that sometimes taking alcohol can put, especially in the withdrawal, the patients can be so desperate and have some desperate thoughts. So you want to ask him in particular about the alcohol. Okay, and you want to know how does he cope with these thoughts. Very important to ask him, how does he cope with these thoughts when he has these thoughts? What does he do? Okay, and it's very important also to know exactly when he has these thoughts, what is the extent of this thought? Is he totally submissive and these thoughts control him, or he, to some extent, these thoughts control him, or he is having the upper hand? So very important to ask him about the level of control over these thoughts. And ask him about the mood. And finally, you want to know some social information. So this is the basic step, because according to this step, you'll set your formulation, your management plan. Okay, are you with me, doctors? In the social part, simple questions about his social circumstances and stresses, and anyone around him to support him, and don't forget access to evidence. Okay, very important to ask about the access of evidence. Okay. In the explanation part, pay attention to this. The suicidal ideation is a very serious and not uncommon complaint. Around 9% of the population, 9% of the population have suicidal ideation, and 60% of these 9% will have the ideation turned into plans in the first years. So you can imagine the magnitude of risk in this complaint. 9% of the population have suicidal ideation, and 60% of the suicidal ideation turn into plans in the first year. Okay, therefore it is important to plan to help the patient while he's having these thoughts. And a very common and a very helpful sentence to understand that suicide is preventable, but unfortunately it is unpredictable. Pay attention to this. Suicide is preventable, but it is unpredictable. And the good news is that interventions could save lives. So now the tricky part, what are you going to do in order to help this man? Okay, very important. What we said before, you should start, but what are you going to do, Dr. Zainab? This is a man who has suicidal thoughts which are serious. So we definitely want to see him more regularly in the clinic, okay? And you must offer the choice of admission to the hospital if during the follow-up there could be a high risk and the patient will be more safe in the hospital. Okay, now what are the plan? Okay, the technical part of how to help the patient. So we have 5 points. Getting through the moment. So when he has these thoughts, what is he going to do? And number 2, making the situation safer. Number 3, he must have an ongoing things to help him to calm down and lift his mood. So point number 1 and 2 is during the emergency, when he has these thoughts intense and he has these thoughts filling his mind. Point number 3 is an ongoing activities which will help him to elevate his mood. And point number 4 is a psychological practice which help him to distract him from these thoughts. He must understand how to know how to do distraction. And this is a mental activity which needs practice. So he must know how to do it regularly. So when he has these thoughts, he can distract. Please mute your mics. He can distract himself whenever he has these thoughts. And finally, he must have a plan of people around him to support him. They can be casual people like the friends and the family members or professional help. Let's go through every point in detail. Okay, anyone has any question regarding what I've said, please write down in the chat section. So getting through the moment, there can be few things that can help for a minute or two to buy some time to use the rest of safety plan. So this is the emergency steps. He must watch some favorite videos, connect with someone, focus on breathing, like what Dr. Zainab said, and take a break by moving to another room or going for a walk. So these are the emergency things which he should do. So this is getting through the moment. So this is number 1. Number 2, he must always make the situation around him safe. So if there are any weapons or anything which can be used to end his life, should be all of these should be removed. Okay, and ask him what can you do immediately to improve your safety. He can go to a safer place. Okay, he can be with another family members, and he must also remove everything which can be used to harm himself. Okay, so far? Okay, number 3.
Yeah.
These are not the point. Number 3 is an ongoing activity which he should use in order to elevate his mood, and this makes the occurrence of these thoughts less common. Okay, so he must write down things that he thinks which will help his mood and help him to feel less distressed or calmer. This is an ongoing activity, like positive reminders of life, calming activities, concentration activities like readings. Okay, so this is an ongoing activity. Point number 1 and 2 are the emergencies, and point 3 is an ongoing activity. Number 4 is a psychological exercise. He must know how to distract himself. Okay. Sometimes the ideas can be so intense we cannot counteract them, but we can distract our mind forcefully, like playing a musical instrument, going to a gentle walk, doing some stretches, jogging, something like this. And finally, he must have a support around him, a supportive network. It can be from the casual persons around him, like the family members or the friends, or it can be from the professional help, like the GP or mental health team or care coordinators or NHS helpline. And then finally, termination, that you must give him leaflets and the emergency contact numbers, and he can be free to book an appointment. This material, you will not find it anywhere. I gathered them from different sources, and I hope that you will find it helpful in approaching this station. And again, the outcome of this station is not that good. So please practice it with your family, practice it with your partners. And if you have any information to add to this material, it's okay, it's good. But as far as I know, this is the best material out there to help you to go through what the plan to help a patient who has suicidal ideation. Okay, hope that you found it helpful. Who would like to go next? We have
Thank you,
Dr. Srabini.
Yeah, urine drug screening.
What?
Urine drug screening, the station.
Urine what?
Urine drug screening. Like the leave the station, I think.
Yes. Urine drug screening. I heard that urine grass feeding.
Oh, sorry. Am I audible clearly?
Yeah.
Okay.
Ready?
Yeah.
Okay. 1, 2, 3, go.
Hello, I'm Dr. Shabuni, one of the doctor from the mental health unit. How can I call you?
You can call me Michael, but well, I didn't ask for a doctor. I want to go to my room, please. I didn't do anything.
I can see you are quite worried at this moment, Michael, but I am here to just have a chat. Like, how are you doing at this moment? And also, I have come to know that you have come back from your leave. So I am here just to have a chat to understand how did your leave go.
Well, it was not that good, but I didn't do anything, and I want to go back to my room, please.
It's fine, Michael. I can see that you are quite concerned to go back to your room. But before that, I need to know, like, how are you doing at this moment?
Well, fine, sometimes, but these voices will come back, I feel if I went to my room, I will be better.
Okay. So, Michael, you mentioned that you can hear the voices. Am I right?
Yeah.
Yeah, also the nurses who are all concerned about you, that at that moment you are also hearing the voices which has come back.
Yeah,
Okay.
I have schizophrenia and I hear voices, doctor. So, this is not. I want to go back to my room. Nothing new.
Okay, Michael. Let's have a small chat to see if we can help you at this moment.
Okay, no problem.
Okay. Michael, as I understand that you have been diagnosed with schizophrenia and you are on treatment here, how are you feeling about that?
Well, no, I'm fine and I want to go back to my room. I take my medications. I do everything right.
That's good to know. And as you were waiting for your leave, how did it go?
Well, not good because my room doesn't have any electricity or water. So I had to stay in the park for 4 hours and I came back here after the end of the leave.
So you need to spend in the park. Did you meet with anyone in the park?
I live in a very dangerous place. There are bad people who sell drugs, and there is a bully. If I don't buy from him, he will punch me. So I bought from him something. I know that this is wrong, but I didn't want to do this.
I'm really sorry to know about that, Michael, that you had to do that. So did they hurt you?
No, but I know if I didn't buy from him, he might hurt me.
So what did you buy?
I bought just two spliffs of hash. That's it.
Okay. And how much did you spend for that?
About 40 pounds.
Do you think it is the actual cost of that? What did you buy?
I don't know, doctor. He said that he wants 40, so I gave him 40.
Okay, and so how much did you take the spliff?
Just 2, 3 spliffs, that's it.
And what happened after that?
Well, nothing. I felt calm but I started to hear these voices again.
Okay, so after that you come back.
Yeah.
Okay. Michael, you mentioned that you couldn't go to your home as there is no electricity.
Yes.
Yeah. So as I understand that, do you get any allowances?
No.
You are not getting any allowances. Okay. And so, what might be the happen to your home because of some electrical point difficulty?
I'm not paying bills. I'm not paying the bills.
Have you ever shared this with your social service team?
No.
Okay. So, Michael, we are really concerned about you, as we can understand that you have taken spliff and you have come back, and after that you are hearing the voices. So sometimes there might be some other substances also can be mixed with this. Okay.
Yeah.
So if we are,
yeah.
So if you can examine the, you can do the necessary test.
I don't want to give, I don't want to do this urine test. No.
I can see that you are quite worried about this urine test. Can you share with me what might be the reason behind that?
But because last time I did, I was kicked out of the hospital and there is no place to go to.
I'm sorry, Michael, that you had to face in that way, but this time we are not going to send you anywhere if that is not a safe place for you.
So
Okay.
are you going to call the police?
No, we are not also going to call the police. We are really concerned about you, as we can see that your symptoms, like your difficulties, have come back. So what we can do, if we are going to examine the urine, we can understand what might be causing this difficulty.
1 minute. 1 minute.
And we can, like as a team, we can address this difficulty. How does this sound to you?
Well, this sounds helpful. So what are you going to do?
But and we are going to do the urine test. So if necessary, we can give you some medications.
But I'm taking medications.
Yeah, but if we are going to, after doing the necessary urine test, we can come to know what might be the reason behind that. Okay. And
Okay.
also, Michael, I can see that you are quite concerned that your house is not at a place at this moment for living. What if we are going to discuss this with the social service team and they can help you in this regard? How does that sound to you? Thank you for being, thank you for being honest with me and talking about all these things. I would like to come back if necessary, and I would like to help you more.
How do you feel about it? Thank you. Time. Give her some feedback, okay? Give her some feedback. Let's see the feedback for our colleagues. I don't know. No one wants to give any feedback to our. No, or this is your friend saying to you, well done. So this is not, this will not be counted. This is not the feedback. Okay, so first of all, when I said to you, I gave you a cue. I'm hearing voices. So tell me more about these voices. I told you in the beginning, I don't know why you kept ignoring this. Tell me more about these voices. So you started hearing them before going out or after going to the leave, because you will just put him in a corner that his mental state was deteriorated after taking the spliffs. Your management plan did not include involving the alcohol and substance misuse team. And you must explain to him that the conditions of his admission this time is different from his condition of admission last time. That's why his admission is this time he will not be removed from the hospital. Okay, you don't need to go through section 17 and so on. Tell him that simply that you are going to take the best decision for him in his favor. You're not going, you will always act for his own good, and definitely getting him out of the hospital is not the best decision. And moreover, the conditions of his admission this time is different. And finally, when you talk about the medication, this man is already on an antipsychotic. So I treat addiction. So the best course of action, if you want to appear professional to the examiner, the best course of action, because this man is already on an antipsychotic, is to wait and see. Many times the patients, after 48 hours, when the body clears itself from the offending recreational drug, the mental state is corrected, and you don't need to add any substance or any antipsychotic. You might need to control any agitation with benzodiazepines, but as long as he's already on an antipsychotic, you don't need to increase the dose unless if after 48 hours or 72 hours, the mental state of the patient did not improve. So in this condition, you might consider changing or increasing the medications. So what you should say is that we are going to revisit your medications, and we will see what could be the best course of action, either to wait and see because you are already on antipsychotic, or we can increase the dose. So this is the best answer. Okay.
Okay.
This is
Okay.
ideal. Okay. We don't give him just antipsychotic because he took somebody. If he was drug naive, he's not taking any antipsychotic, you can restart him on antipsychotic. But if he is still on antipsychotic and this psychosis is new to him due to an offending recreational drug, we wait and see the best course of action, and then we can change the medications. So let's see, according to our psychological management. Yes, psychological is the risk assessment. Good risk assessment. One of our colleagues talked about the risk assessment. Very important. You must ask the patient about the risk, any thoughts of harming himself or anyone else. The psychological management of substance misuse is simply the rehabilitation process, which is the alcohol and substance misuse team job. So let's see according to our PDF. Okay, so let's see. So this is the management task. The first thing, as I always say, you have only 7 minutes. Introduce yourself, gather some important information before talking about the management. Sometimes you need to do some explanation, formulation, and finally management. So we talked about the step of introduction. Then you gather the biopsychosocial information. Socially, the best thing is to start talking with him casually about his leave. Tell me more about your leave. Where did you go? What did you do? Who did you meet? Okay, so you want to know more about the leave. So this is social information. And then finally ask him about his life circumstances and anyone around him, etc. So, but basically, the problem is all about what happened in the leave. So this is the part which you should check in the social information, okay, of your biopsychosocial gathering. Then psychological is his mental state. You don't need to do a full mental state, but I just elaborated that I am complaining of auditory hallucinations. Just one open-ended questions, 2 to 3 closed-ended questions are enough. Okay. Physical, if he's having any physical complaint, and finally, like what our colleague said, very important to ask about the risk. This man is someone who has been exposed to bullying, he's taking drugs, so you definitely want to know more about the level of risk. Okay, now the part of explanation, you want to explain to him why he must do this urine drug screening. So this is part of your communication skills. How can you persuade him to do this urine drug screening? So this is something which you can say. However, part of the medical care is to do urine drug screening after returning from the leave. Also, it was one of the conditions before going to the leave. This is how you start, okay? He will also refuse. So you want to know from him, why is he reluctant to do this? He will explain that he's afraid that he might be kicked out of the hospital, or you are going to call the police. And then you will explain to him that this is not the case, that you are going to take the best course of action, etc. The thing which I did, okay? You can formulate, please formulate, doctors, according to all the information which I gave you. I want just Dr. Srabini formulate, please.
Okay. Okay.
Pay attention, doctors. The formulation is a clinical skill and also communication skill, because simply you are explaining the problem for the patient. And according to this explanation, you are going to set your management plan. Okay, so please formulate.
Mr. Michael, thank you for talking to me. What I understand, that you were admitted in this hospital under the section 17. And sorry, he was not admitted under section 17. He was went for the leave for section 17. Am I right?
Yeah.
Okay, sorry. Yeah. Thank you, Mr. Michael, for talking to me. I understand that you were admitted and having the diagnosis of schizophrenia with substance use. And you are went for the section 17 leave, following which we have seen that some of the symptoms again come back. So we are concerned here, we need to do some tests, that is a part of the section 17 leave also, that is the urine for drug screening.
Okay, so this is the formulation. Please have a look at my YouTube channel. You'll find how to formulate, explanation of how to formulate in the YouTube channel. It is a simple task and simple skill, but it is the very first point to be checked in your mark sheet. Simply, you start by stating the main psychological problem and the level of risk, and then state all the background information which you know or you need to know about the patient. Okay, I'm not going to say more than this regarding how to formulate. More details, you will find it in the YouTube channel. So
Okay.
always when you talk about the technical management steps, most probably you will start talking about this in the last 90 seconds. So you must be very well organized. So what we say always, first thing, what Dr. Srabini is going to do and where the patient is going to be treated. So you will follow him up more regularly because this man's mental state has been recently disturbed. And also you are going to do thorough risk assessment and mental state and physical assessment and address all his concerns. So this is the first thing. And where he's going to be treated in the hospital, as we said. So this is the first thing which you should say. What are you going to do and where the patient is going to be treated? You will follow him up and he will stay in the hospital. You need to do some investigations like urine drug screening, and you might need to do some blood tests because you might change the medications. Now, regarding the management, okay, the management, you must verbalize it. We will do a management plan which will cover all your needs, psychological, physical, and social. Regarding the medications, as I said, there are two options. Either we wait and see, or we can do subtle change in his medications. But the best course of action is to wait and see because this man is already on antipsychotic. He needs some talking therapy regarding his substance use, and definitely you must talk about the social aspects of your management because this man, when he goes out, he doesn't have anywhere to go, so the social services can help him. And finally, terminate. Okay.
Is it important to mention about the safeguarding during leave?
Safeguarding
No.
for what? Safeguarding for what?
Yeah. No, because in the leave, as he was being threatened and all that.
This is the first time someone raised a safeguarding issue in this station. Can you tell me more about this? There is no safeguarding in this station.
Mostly in the like the suicidal.
There is no suicidal. So suicidal.
There is no suicidal.
Dr. Hussam, I believe this vulnerable guy has been used by drug dealers in the community, and
yes.
And he was given one SPLF for 40 pounds. And I believe the case related to the exam itself or related to SBMM notes is that it is not the only time. There is repeated occasions of being mistreated by drug dealers because he has schizophrenia, and the guy that sells the drugs to him is a big guy. So he's afraid, like you said, you are afraid from him, and that's why you take two SPLF for 40 pounds.
Okay. So they can just raise this to social services so they can communicate with the police, and that's it.
Yeah.
No more is okay. That's it. So this is your management plan. Okay, and this is how to approach the station. As you can see in this station, there is a big magnitude for the communication skills. Let us have a look at the mark sheet. And again, doctor, please, whether you are following my notes or any other notes, make your reference and your reference in this mark sheet, because this is the mark sheet in the hands of the examiner, and make sure that you score in this mark sheet enough to pass. But unfortunately, Dr. Srabini did not formulate, so this point will not be scored. Phase to recognize significance of each you did recognize, so this point is going to be scored. Adequate management plan, unfortunately, did not talk in the best way regarding the medications or even the alcohol and substance misuse. So unfortunately, this point is not also be scored, does not pay sufficient attention to the patient's health, nor you paid attention to him. So this point will be scored. Adequate risk management, you did not talk about the risk at all or ask him about. So this point is not going to be scored and does not identify appropriate psychological social interventions. Again, this point might or not be scored for you because you did not talk about substance misuse team. You talked about social interventions. So out of the first 6 points, you might score maximum 3. Though I felt that you're professional and very good, but as you can see, when it comes to the mark sheet, it is a totally different story. And pay attention, doctors. For all of you, you might feel that you're doing so good, but when it comes to the mark sheet, it is a different story. It was very organized. I didn't feel that you are messed up. Was not formalic. Everything in your communication skills was good. So I hope that you found it helpful.
Yeah,
And pay
thank you.
attention to the mistakes of your colleagues, doctors, because most probably it is the same mistakes which you do. Okay, thank you, Dr. Srabini, very clever. So who
Can I
am
go
I?
next, Dr.
Okay, doctor. So, doctor, what's your
Dr.
name?
Hussam, may I ask for something?
Yes, doctor, please. You can write down.
Is this the only competency domains that I mean, is it because it is management station? Is there other competency domain for history taking and risk assessment and so on, or it is the
Yes,
it is the
there
same for
are.
all stations?
There are other different mark sheets for every task. Yes.
All right.
Okay. Assalamu alaikum, doctor. So, what is your
Alaikum
station?
assalam. It's a learning disability, sterilization, and cry for help.
Okay. Again, this is a station which is all about the communication skills. Please give me 1 minute.
Sure.
Okay, ready, doctor?
Yes,
Ready?
Dr. Asam. Yes, thank you.
Okay, 1, 2, 3, go.
Hello there. Is that Dorothy?
Yes, yes, I'm Dorothy, doctor, and I hope that you help me, doctor, with my big problem. I hope that you
Yes.
understand my problem.
Sure, of course. I'll do my best. I'm Dr. Gowri. I'm one of the mental health doctors. And please tell me how I can help you today.
Well, I want to sterilize my son Robin because he is not able to be a father, and he is having a learning difficulty. and his girlfriend is also having learning difficulty, and I'll be the one who will take over the responsibility of my grandson. I cannot go over all the difficulties which I had in taking care of him. Please help me and sterilize him, please, doctor.
I'm so sorry to know, Dorothy, that you're very concerned about your son, Robin. And I understand that Robin has a mild learning difficulty as well as his partner, and the partner is now pregnant. So, and you're worried about them and you want him to get sterilized. Am I
Yes,
right?
yes, yes.
Okay. I would like to tell you, Dorothy, it is not possible to go ahead with your request because although Robin has a mild learning disability, he has the same rights as any other normal person according to the Human Rights Act. So he would have to consent to this procedure. And moreover, this procedure is a surgical
Doctor,
operation.
you don't understand the difficulties which I had. I had a horrible time in bringing him. He has learning difficulty, and his child will also have a learning difficulty. I cannot go through all this again, doctor.
I understand, Dorothy. I know that you're very concerned about what's been going on, and I'm here to allay all your concerns. So, with regards to you feeling that the child might also have a learning disability, could I ask you a few questions about the pregnancy you had with Robin? How did that go?
Everything was fine.
Okay. And how about the birth?
Well, it was a bit complicated, but eventually everything was okay.
Okay, could you please share with me, if you don't mind, what you mean by the complications you
Well,
had?
they said that he needed to stay in the baby unit for a while because he needed to breathe early and there was no sufficient blood. I'm not good with these technical terms.
Yeah, yeah. Thanks for sharing that with me, Dorothy. I really appreciate that. So, from what you've told me, it seems like he had lack of oxygen supply to his brain, which caused the learning difficulty he's had. So, it is not necessary that if the parents have a learning disability, the child will also have a learning disability. And I'm sure his partner is getting all the necessary scans and everything is going so well so far. And
How did you know that his partner is is getting all the scans?
because he belongs to the team that I'm under, and they have not raised any concerns about that. And I will also make sure that going ahead, all the scans are done and we look into it closely. We can involve other team members, such as the child specialist team, as well as the social work, who will do all the assessments that are
Doctor,
required, Dorothy.
the social services told him that they are going to take his child, and you know what did he do? He started to expose himself. Whenever he is stressed, he exposes himself, and I had to go to the police and explain everything to them.
Oh, I'm so sorry to know. Can I ask you, when did this happen?
About 2 days ago.
Okay, okay. And has it happened before with Robin?
Yeah, whenever he's stressed, he does so.
Right, okay. So I suppose the stress is more now because he's going to be a dad. Do you agree with that?
I don't know though.
Okay,
They
so
told him that they are going to take the child from him, and he was so stressed. So I know that whenever he's stressed, he expose himself.
Okay, Dorothy, I understand what you're coming from and your concerns, but I look into this more closely because there's no necessity for the social work to do that just now. They would look into it and see how best they can support him. And we could also get psychology to address the concerns that Robin has and speak to them. And, that might help as well.
Doctor,
But I
but
would like
but when he cannot have babies, doctors. I understand the abilities of my son. He cannot have babies. He must be still. I will sign all the papers, doctor. Please help me. I will not be able to take care of a child who has learning difficulties.
I understand, Dorothy, and I'm sure when you were bringing up Robin, it must have been difficult for you. But now things have got a lot better, and the social services would look into the needs assessment and see how Robin and his partner can cope with the
1
pregnancy,
minute remaining.
as well as when the baby has come, they would have a regular monitoring to make sure that they can look after the baby themselves, and you can just be the grandmother and look and just be there to support them, and you wouldn't have all the responsibility. And with regards to the contraception or the sterilization, as I told you, that would not be an option, but I could discuss with Robin and his partner about other family planning methods that if they would like to consider, and see that if that would work for them. How would you feel about that, Dorothy?
So how can you help me?
So first of all, I'll speak to Robin and see what are his concerns and what. Okay, thank you.
Continue. I did not. You're
Oh,
still.
sorry, I thought the time was up.
No, no.
Yeah, so I'll speak to Robin myself and see what his concerns are and what he would like to do with regards to the family planning, and we take it from there.
I see. Okay. Time. How do you feel about what you did? Give me
Right.
feedback.
Okay. I had a few things. I don't know how the flow went, but I wanted to explore about her,
Yeah.
the way that she brought him up. But I think I just gave it myself, so maybe that wasn't right.
So first of all, pay attention. Never give fake information because this means that you are unsafe practitioner, and definitely this is a deal breaker. He said that all scans are done for his girlfriend. This piece of information you don't have, so you don't volunteer saying that everything is okay regarding his girlfriend, she's following up, and so on. I don't know why did you give this is a fake reassurance. As far as I know, it is considered that you are unsafe practitioner and you will not pass the station. So pay attention to this mistake. It is a deal breaker. So it is a fail even if you continued the station program. Pay attention to this. So let's see according to our mark sheet. There we go. This is yeah. Okay, as you can see, this station has a lot of communication skills in it. So the magnitude is very big, and magnitude of communication skills is very big. So after introducing yourself, the point of introduction, so you want to know exactly what is the difficult time which she had in raising Robin. And this is the key in order to show that you are empathetic and you are very close to what she is suffering from. And ask some information about Robin, which will help you to formulate a management plan. Does he have a job? Can he depend on himself? Since when he's living with his girlfriend? Since when they are living together? Since living together, if they have faced any problems, okay? And how did you know that his girlfriend is pregnant? So these are all information which you need to know. I know that you already know the station, but you don't act as if you know the details of the station in real station. So you want to know how did the lady knew that his girlfriend is pregnant? Why do you feel that he will not be able to take care of his child? And why does she feel that she is the one who will be in charge of the child? So this dialogue is the very first thing which you should do, and the very first thing which you start with, because this is how you can absorb the magnitude of her emotional stress on you that she wants to sterilize the boy. Then continue gathering the information, ask about the physical and the psychological, because this boy is already under the care of key coordinator and he is in contact with psychiatric services. So you want to know more about his mental state. and you want to know just the mental state of his girlfriend, and finally ask about the risk. And if you ask about the risk in the beginning, you would have picked up that this boy is exposing himself. So if we have a systematic approach, you will not miss any tricks of the Royal College. So in the beginning, you show empathy, gather the social information which will help you, and start by the social information which she will raise that she had problems in upbringing this boy, and ask her about some social information regarding this boy himself and his relation with the girl. Finally, the physical, psychological, and the risk. Okay. And when you talk about this particular problem of exposing himself, couple of questions. Can you tell me more about this? Anything, does he does this for sexual pleasure? And you will find that it's not related to sexual pleasure. It is not the exhibitionism which is related to the paraphilia. It is something related to his mental problem, okay? Then you explain to her, the points which she is raising regarding the sterilization, okay? And again, this is not a textbook information, this is a communication skills. Simply explain to her that it is not feasible, but at the same time, there is another option, which is the family planning. That's it, simple as this. You don't need to go again in the human rights and all this stuff. Just explain to her that it's not feasible. This is something which the patient must require himself. There is other options. And the point which will make you more professional is that if he sterilizes himself or sterilization is done for him, this is a stressful condition for the for his son, and this will deteriorate his condition. So this is how you address this sterilization. She will ask about the children having a learning difficulty. And again, you must show that you are professional and you have some factual information, because we know that even healthy persons can have children with learning difficulty, because the statistically, the prevalence is around 2.5% of all the population will have of all born children have learning difficulty. Okay, and say that there are many reasons behind this, but you need to know more. But again, having a child with a learning difficulty or having a father with a learning difficulty, this does not mean that this will not be a happy family. Again, this is a communication skill. She will also say that she will be the one who will take care of the child. Okay, but you must explain to her that this is not the case. Many changes are there which will help the family to take care of the child. She will raise the question, and all these are the questions which you are going to get in the station. The social services are going to take the child from her, from the boy, okay? You must explain that the role of the social services is to protect the child. And there's a big chance that Robin, again, this is a very professional answer, Robin has misunderstood the conversation. It is not uncommon that this is not the case. The man, because of his intellectual disability, he might have misunderstood the problem. She will talk about taking care of a child, again, raise the concern that it's not the case. Social services and many steps will be taken to help this family to take care of the child and to be a functional family. And on the contrary, she will enjoy her experience of being a grandmother. Again, this is a communication skills. I had this station once and I passed it, though the passing rate is very low, because I understood from the beginning that big magnitude on the communication skills in this station. And in this station, you will get a nagging lady who is always complaining, and she will stress on you to talk about sterilization and her difficulties in upbringing the child. And if you do not address this in your dialogue with her, you will lose the station. Okay, I want you to formulate the station, please, for me, Dr. Saida. Please formulate, please.
So Robin is 30-year-old gentleman with the mild learning disability. He lives in a residential care home. He had a relationship with another resident, and now she's 4 months pregnant. His mom is worried about him, and he wants him to be sterilized. And Robin thinks that
Well, doctor, it seems that you don't understand the question. This man is not in a residential. He's living alone with a girlfriend, and he's dependent on himself. That's it. It's not a residential home. They are not living in a
it,
residential.
it was in the task that he's in a residential care home.
This is a different one, because well, the one I get is that he's decided to be dependent on himself, and he's living alone, and he's getting some sort of income. Okay. However, when you want to formulate, avoid these historical details where he is living and the source of income is not the case. He has learned. So the first line is that talk about the learning difficulty, the main psychological problem, and the level of risk. So he has learning difficulty, his mental state is stable. However, there is risk because of his maladaptive way in coping with the stress. So this is the first line in your formulation. All this on the background of the information which you know or you need to know. So you can say something that, like, all this on the background that he is independent, he is about to have a baby, and we need more information about the couple's parenting abilities. Okay, so this is how you formulate. It's not a 100% academic formulation, but you must show the examiner that you're able to formulate, you are able to pick up the most important piece of information in the story and simplify it in an organized way. This is how the formulation, this is the formulation, okay? Now, regarding the management, the first thing is, what are you going to do, Dr. Sayeda? We always say you must have a very organized way to talk about the management in the last 90 seconds. So the first thing, you should talk with the patient himself, address his concerns, and do thorough risk assessment. And also, you want to talk with the social services to understand more about what happened with Robin. So you must be assertive as a professional. You must know exactly what happened from the patient and from the social services. And definitely you're going to do a mental state and risk assessment. Then talk about the team. We always verbalize that we are going to cover all the patient's needs, physically, psychologically, and socially, in order not to miss any point in the mark sheet. So psychological, the habit of, so you have a psychological problem here, which is exposing himself. And the good news is that this can be fairly controlled by the CBT. Are you with me, doctor? CBT, particularly the behavioral part, because his mental ability is low, so the behavioral approach is better in these patients, okay?
Sure.
There are also several programs that your son and his girlfriend can attend during the pregnancy to help them prepare for taking care of the child. Okay, so this is the psychological part. The social part. Regarding his social circumstances, we can book an appointment with the social services to discuss the parenting abilities. And in this context, the social services will do parental assessment. Very important to talk about the parental assessment and the abilities of the couples to take care of the baby. Okay? And it would also be a good chance to discuss the support which they can get from the social services. Physically, we can arrange with the obstetrician. This is the physical part, not the sterilization, but arrange with the obstetrician to follow up the pregnancy and to arrange for the delivery. And if you want to add a cherry on top, talk about the ultrasound to make sure that development of the baby is okay. And finally, terminate. I hope that you found it helpful. This is how you talk about the management, but as I said, there is a big magnitude of communication in this station. Let's see, according to, there is no mark sheet here. So next time we'll find a mark sheet. Okay, I hope that you found it helpful, Dr. Sayed. Okay?
Yeah, thank you.
Thank you. So I would like to go next. I would like to go.
Can I?
What? Doctor, Doctor
Teacher. The
Rashid.
last station.
Okay,
Yeah.
so what is your station, doctor?
Early onset psychosis.
Early onset psychosis. Okay. Are you here?
Yes, sir.
Ready?
Yes.
Okay. Start.
What is the name of the parent?
Mr. White. 1, 2, 3, go.
Hello, Mr. White. I'm Dr. Ashpita from the mental health team. I understand that you're here today to discuss more about your daughter. We have understood until now that she has some unusual experiences. And would you like to discuss more about this?
Yeah, I want to know exactly what is wrong with her, doctor.
Yes. So what, I'm sorry, what is the name of the child?
Michelle.
Okay. So Michelle has been having certain strange experiences for the last 2 months. She's been having ideas that others are planning to harm her, others are talking about her, though she does not have any unusual voices. These are pointing towards what we call as early onset psychosis. Have you heard about that?
Oh, what is this early onset psychosis?
Psychosis is basically a condition where there is a loss of touch with reality, and these people have certain strange experiences of probably hearing something that others cannot, seeing something that others cannot, or feeling that their thoughts are being interfered with, or that people have a negative intention towards them. So Michelle is also facing similar things, and the age at which this occurs is a little later, but for Michelle it has been happening a little early. So this is what we call as early onset psychosis.
And
Here,
what could be the cause for this early onset psychosis?
the causes are multiple. We cannot pinpoint towards what really can be the causes. It can be genetic, it can be certain chemical variations in the brain, it can be any, if any, substance use, or any childhood stressors, like if she had a difficult childhood. So there are multiple possibilities. It could also be certain mood disorders, like if there is some depression, or it could be even certain medical causes which look like psychiatric symptoms.
I see. So, well, could be there any other diagnosis?
At the moment, it looks like a prodrome of something. We still do not have the entire picture. It can go forward to become basically, not everyone who has this problem progresses into a complete disease. They say around 3 to 5 of 10 people progress to possibly schizophrenia, or there can also be bipolar disorder or certain mood disorders. So there are other severe mental disorders which can come following this illness, but that does not happen always. We just need to take certain steps and reduce the risk factors which can push into this entire picture.
So, do you feel that she might get better?
Yes, there is a good chance that she does not go into any full-blown disease, because there are certain pointers. Like, for example, we have not got any family history of psychiatric disorders. We've not seen that Michelle uses any substances. Michelle's mood is generally okay. So considering these, and also that she does not have any significant social stressors, considering these, the chances of her getting better is high.
I see. So, well, how can you help her?
At this stage, we can do biopsychosocial management. This is what we call, basically, we can take care of the biology. We can take care of her thoughts with the help of what we call as cognitive behavioral therapy. This is a talking therapy where we can work on Michelle's thoughts, feelings, and behavior, and her perception about the outer world, so that her thoughts don't develop into full-blown delusions, or that she does not she does not get very much affected even if these kind of persecutory ideas erupt. So this is what we can do. Also, we can do social measures where we can enhance her support system. We can involve her into the things that she likes to do. We can keep her more occupied. We can keep her also we can keep a continuous check, along with the help of community mental health services and child mental health services, who will repeatedly do visits to ensure that Michelle is all right.
Okay.
Anything more that you understand from me?
No, just very helpful.
Can you tell me if there is any risk that you see at the moment? Can you tell me if there is any risk that you see at the moment? Like, for example, Michelle trying to hurt herself, or Michelle getting aggressive against anybody?
Well, I don't know, doctor, because she doesn't speak with us. Maybe he knows more.
Okay, so if we can also keep a check for worsening, if we see that the symptoms are getting bad, then there is always a consideration of medications. There are certain antipsychotic medications. Basically, these are the medicines that act on the brain chemicals, which can prevent the full-blown problem, or help in recovery if such a problem occurs.
Okay, time. How do you feel about what you did?
I think it wasn't very planned.
Okay. Yeah, well, not very organized. So let's see the feedback of our colleagues, and I will give you feedback. So let's see. You have good knowledge answering Give short chunks, yes. Counting and checking is very important. Ask about stress and family, yes, very important, yes. Again, some social information. So I'll give you my feedback in details. So the first thing I asked you about the differential diagnosis, you talked about the prognosis. There are differential diagnoses which we are going to see. Now the prognosis, you talked about things which you don't know, that you don't know. You gave me fake hope that she doesn't have so and so, so there will be a good hope. How did you know? You did not ask me about any information which your colleagues have just said. Gather some information from the patient when he asks you about the prognosis. This will help you to answer the question professionally. The information you should gather is the biopsychosocial information and the risk. And eventually, you found yourself that you need to ask these questions. But it was very late because you asked me about the risk very late in the maybe last minute. You asked me about the level of risk. This is a very late ask about this question, about this important area. You should gather the information as soon as possible to have a good idea about this patient in order to address all his concerns. Formulation, do not formulate. Chunk and check, he did not chunk and check. Okay, and you asked about the risk too late. So let's see let's see the feedback. Gather information first, yeah, very clever. Yes, so as I always say, doctors here, only 7 minutes. Try to have a good management plan, 5 points, we'll focus on them and be organized as much as possible. This is our management plan in the 7 minutes. First of all, you introduce yourself and show that you are professional, meet your patient and so on, and show empathy when he talks about his daughter. Always show communication skills in the very first minutes, because this is the best part to show your communication skills. There is no meaning to show empathy after 3 minutes, after all the complaining and so on, and then you start to show empathy. In the very first minute, after when you're feeling the complaint, this is the best time to show empathy. Please, doctors, mute your mics. Now, the second step, either to explain or to gather information according to the flow of the conversation. She can say that she is already assessed psychologically. No need to assess her, but you want to know more information. Ask her about the social circumstances and so on, any bullying, anyone around to support her, etc. And ask about the level of risk, because there's a history that she is taking cannabis. Any concerns about his safety and so on. Then the explanation. You did explain the first onset psychosis, but it was not very fluent. I felt that you were struggling, so you must be prepared with a fluent, simple explanation. What are the causes for the first episode psychosis? Typical answer, we don't know particular cause, but there are some factors which increase the chance of having the first episode of psychosis, like having a past history or family history of psychiatric disorders, recreational drugs, or chemical imbalance in the brain. So this is the typical answer when you are asked about the cause of any psychiatric disorder. Could there be any other diagnosis? Here's one of your mistakes. Yes, it can be secondary to substance misuse, or it can be secondary to depression. Is she going to get better? Again, this is a typical answer. This is a question about the prognosis. Typical answer, there are factors which favor the good outcome. Okay, like the early start of the treatment, the absence of mental health problems in the families, the absence of stresses, the good functioning before the onset, also the nature of the symptoms, very important if you want to show that you are professional. The nature of the symptoms determine the good outcome. Having positive symptoms like delusions and hallucinations, like the case of Miss X, this has better outcome than the negative symptoms like self-neglect and less of motivation. So this is how you answer this question in a professional way. How can you help her? This is the best place to squeeze in your formulation. Having said this, please rapidly formulate the station, please, doctor. Formulate.
Miss Michelle is a 17-year-old girl who has no family history of psychosis.
All this is our historical details. We want the main psychological problem, the level of risk, the background information. Okay, this is how you formulate. Okay, we don't need any historical details. What is the main psychological problem? What is the level of risk? What are the background information which you know or you need to know? Go ahead, 1, 2, 3, go.
Michelle is a 17-year-old girl with symptoms suggestive of early onset psychosis, with no significant risk of self-harm or harm to others. There is presence of cannabis use, so we need to certain if that can worsen the prognosis. We also need to work on the family support.
Okay. Okay, so this is how you formulate. Maybe here, I did not write the cannabis, but you should write the cannabis. Okay. Okay. So the first line is talking about the main psychological problem. She has first diagnosed psychosis, mainly positive symptoms, low level of risk, all this on the background of having good support, no past history of psychiatric disorder or physical problems. However, there is a positive history of cannabis misuse, and ask him if there are any other points which you would like to discuss. Again, we have a stepwise approach in talking about the technical management steps. The first step is, what are you going to do, doctor? As a professional doctor, definitely want to talk to your patient to explain to her her diagnosis and address her concerns. So this is the first thing which you should do. Okay, and do thorough risk assessment. And where she's going to be treated, ideally should be treated at home. However, if during the course of management, the risk becomes high, the admission in the hospital should be considered. Okay, so this is how we start talking about our management. What are you going to do and where the patient is going to be treated? Definitely, as long as you are going to give medications, the patient needs to do some investigations. So what are the investigations? Don't say it just opened information. I'm going to do some blood test. You must make it clear. Liver functions, right? Kidney functions, CBC, heart tracing, and urine drug screening is very important to exclude substance misuse. Okay? Are you with me, doctor, so far? Hi, doctor.
Yes.
Are you with me?
Yes,
And
sir.
then talk about the team which will follow her up. As you can see, this is the typical stepwise approach in how we talk about our management plan. What are you going to do? Where the patient is going to be treated? Number 2, the investigations. Number 3, the team which will follow her up physically, psychologically, and socially. If there are any physical problems, and by the investigations, you are going to liaise with the physician psychologically. Talk about the medications, particularly alipiprazole, which is the best medication in her age group. Okay, this medication will correct the chemical imbalance behind the psychosis, and we also have a talking therapy like CBT. Okay, are you with me, doctor?
Yes.
And talk about the substance misuse team regarding her problem with cannabis. And don't forget, doctor, you have a patient who is a school student, so you must talk about the social services which will communicate with the school to make sure that the period of treatment will not affect her education. So this is how you talk about the management. As you can see, there are biopsychosocial points which you have missed, doctor. Too many points which you have missed. And don't forget the social support for this girl, okay, regarding her education. Very important. You show that you are professional, so show that you are different from the other candidates. Okay. This is the last time which I will go through the management mark sheet. First point, formulation, you did not formulate. Significance of findings and results, you did identify the significance of findings and results. Unfortunately, your management plan was not good. You did not talk with your patient or address her concerns. So the first points, 3 points are not going to be scored for you. First 4 points, you did not assess the risk, and your psychological and social intervention are poor. So as you can see, first 6 points are not going to be scored. Regarding the communication was very disorganized. Don't be frustrated. I'm just trying to help you to understand how you are going to be assessed. Definitely, you're very clever in your work. But as you can see, the task is a game, and the rules of this game in order to pass. It has nothing to do with your proficiency. Okay. Thank you so much, Doctor.
Thank you.
Okay, who would like to go next?
Yes, Dr. Hassan. Can I go next?
Dr.
Assalamu
Hassan,
alaikum, Dr. Ann.
can you mute other people because there is more than 4 open.
Yeah,
Yeah, there are Joe.
yeah, a lot of noise. Yes, I'm ready. Okay, Dr. Anas. So what is your station, Dr. Anas?
Dementia and DVLA.
Yeah, this is a new station which I also have succeeded to bring the material of this severe dementia. Yeah. I've succeeded
so
to
I
bring
think-
the material of this station. It is a new one. So
Thank you, brother. I should talk with the son, right?
yeah.
Regarding his mother. Can I start?
You want to start? Okay. But give time for the
yeah.
candidates to read this material of the station. Okay, because this is a new station. Maybe they don't have an access to the materials. So you can have an access to this new station, and I hope that you pay attention to it because the passing score is very low for this station. Okay. Ready?
Yes. What is his name and her mother?
The
His
name
mother?
that the lady's name is Mrs. White, and you are talking to her son Michael. Okay, so let's start.
Okay.
1, 2, 3, go.
Hello, Mr. Mike. I'm Dr. Anas from Mental Health. I understand that you come to talk with me regarding your mother.
Yeah, doctor, I've gathered that she did some memory tests, and I want to know more exactly about the results of these tests.
I understand your worries. Unfortunately, their tests show her memory is affected. So I would to talk with you regarding her to understand more about her condition. Is it okay
Yeah,
with
yeah.
you?
Okay.
Could you tell me more about her mood last 2 weeks? How did you find her mood?
Well, her mood is fine, actually. The problem is that I don't feel that she cares too much about the problems which she's facing. She's very independent, and I'm worried about her.
I understand this. So you not feel about her plan. Other than this, did you find that she going to unseen stimuli or anything?
No.
Okay. And did you realize if she used any alcohol more frequently recently?
No. She doesn't. Well, she doesn't say that she is drinking, but I know that she is drinking, but she doesn't want to say. I don't know, doctor, but
Yeah,
I find bottles of alcohol in her home, but she doesn't say that she's. And when I ask her, she says she's not drinking.
I understand. It must be concerned. We will look forward about this drinking. But other than this, she has any physical problem? Do you know if she has any other physical problem?
Well, I don't know, doctor. Well, she should have been following up with the GP. He said that she must follow up regularly, but she doesn't want to follow up.
Okay, understood. And who stay with her? Do you stay
No
there?
one,
Or
no one is staying with her.
she able to take care about herself?
Well, I don't know, doctor. I don't think that she's able. She's facing a lot of problems. She did in a car accident last week, and the week before, she did also a car accident, and I don't know what to do, doctor.
She's still driving after this car accident.
Yeah. She doesn't want to stop driving.
Oh, okay. Thank you for all this useful information. From you, information that you tell me, so she has something, and depend on psychological assessment that we did. She has something we call the dementia. Did you hear about that?
What is dementia?
Dementia is progressive decline in memory abilities, and that affect the different executive function, brain function, and personality. Uh, and regarding her drive, we will see later about license and drive. We need to talk with DVLA regarding this issue, as it may be risk for her to drive.
I see. Do you feel that she's able to drive?
In that time, I will give you a little bit about the condition, her condition, to understanding more about her condition. That it will be a high risk for herself and for if she keep driving.
I see.
We
So
have
I'm
more
one.
questions.
Well, I'm wondering, doctor. So she doesn't want to stop driving. Well, what can we do? How to persuade her to stop driving?
In this time, we need to inform the developer. You can inform or her And if you find difficulty for that, you can inform the social service. They will inform DVLA to stop her license. And again, we will need to talk with her to explain to her about how risk if she keeps driving.
So how can you help her, doctor?
Thank you for your questions. And to recap what we talked about, Mrs. White has dementia, and she not taking the medication, and and is still driving. That contributes to risk to her safety. All that in background, that we have no many social support, and we have suspicion of alcohol using. So to deal with this point, we need to assess her more physically, and to do urine test to find out if she has a problem with alcohol or any drug, and to do more investigation before starting treatment, like liver enzymes and the renal and heart tracing. If we found any problem regarding, if you find any problem regarding alcohol or drug, we can go forward for detoxification, and that will be need to hospitalize as we don't have enough social support. But if she don't have any problem regarding alcohol, she can we can offer care package for her to treat it at home, and we can make a frequent psychiatric nurse to check her, and make medication in dosage box to make her remind to taking the medication. We can start to give medication by depend on condition. Later on, and as a regard, the most important thing, social services, that we need to talk with them regarding the DVL and her drive. Thank you for coming to talk with me. I will give you leaflets about
time. How do you feel? How do you feel about what you did?
I feel I covered mostly things. I don't know.
Okay, so it was nice, but you know how to, but you need to be more organized and revise the materials. Let's have the feedback of our colleagues. Formulation, yeah. Okay. Let's see. This is a very new station, and the outcome of the feedback from our colleagues about this station is not that good. So let's see the story, the beginning. What is the story? So this is a very old lady, and she came to you, and the score is as you can see, it has a score which can put her in a station of moderate to severe memory problem, dementia. Okay, in addition, she has problems in her liver, and she is drinking, and she has problems also because she is driving cars. Okay, she's still driving, and you are going to talk to her son and pay attention to the task. You must formulate the condition. As you can see, the Royal College is paying attention to the candidates who are able to have these clinical skills, meaning that who are able to formulate. So the task is to formulate, and then you must explain the assessment of the patient or mother to the patient, to the son, in a very simplified way, and discuss the management. Okay, so this is the story of this lady, which is related to this new station. So let's see how we can tackle this new station. Okay, so the first thing is that you introduce yourself, and the first thing is to address his concern. I ask you, what is wrong with my father, with my mother? Explain to me the results of the investigations, that she is having a memory problems as well as the liver function test. So this is the first mistake. I wanted to know what's wrong with my mother. Explain to me that she is having a memory problem, which puts her in the category of dementia, in addition to liver problems, and gather the information which you need to know about her mood, the biopsychosocial, her mood, okay, and the unusual experiences, the physical problems, the life circumstances, and don't forget the risk. So this is how you start the station. Explain to him the results of the assessment and gather the biopsychosocial information and the risk. Are you with me, doctor?
Yes, doctor.
Okay. And open with him the problem of alcohol, because she's smelling, or she was smelly. Ask him about the alcohol. Okay. Ask him about the relative risk. So this is the big area here to discuss, because this lady has a lot of risks. Why you should focus on the risk? Because later on in your management plan, you are going to propose the possibility that she might need to stay in a nursing home. Okay, this is a typical patient who should stay in a nursing home, posing risks to herself and others because of her driving, and her physical condition is deteriorating because of alcohol intake, and there is no support around her. This is a typical patient to be put in a nursing home. Okay, ask him about her ability to take care of herself and going to the bathroom and not driving, etc., and falling. And then explain to him the problem, what is dementia, if he doesn't know what is dementia. Okay. Is she able to drive? Definitely this is not, she is not able to drive. It is recommended. How to answer this question? It is recommended to inform the DVLA, which probably will suspend her license because of the high risk. I will give you leaflets about it. And now the challenging question, how can I persuade her to stop driving? It will be helpful if a meeting with her is planned, which will include the relatives, a psychiatrist, social services service. We will discuss with her the possible safe alternatives, and at the same time address all her concerns and the need to drive. Also, it will be explained to her the possibility of illegal action taken for his safety if she insists on driving, like custodial removal of her car. Okay? If she insists on driving with her mental and physical condition, custodial removal of her car can take place. Okay? How can we help her? Again, this is a place you should formulate. The first line is talking about the main psychological problem and the level of risk. The second line is the background information, which you know, or you need to know about her other domains, the biopsychosocial domains. So she has dementia, which is not managed, and there is considerable risk on her because of her medical and physical and social circumstances. All this on the background of having medical disorders, alcohol intake, and low level of support. Okay. Now, regarding the management, again, doctors, you must be very organized when you talk about the technical points of the management. Most probably, we'll start talking about them in the last 90 seconds. First point is, what are you going to do and where the patient is going to be treated? You want to see the patient yourself, address all her concerns, and explain to her the level of risk of driving. And according to the assessment, she can be managed at home with a care package to cover her needs, or she can be placed in a nursing home if the risk is high and her needs cannot be met. So this is how you start talking about your management. what are you going to do, and where the patient is going to be treated. Number two, regarding the alcohol detoxification, bearing in mind that her age and the possible physical complications from alcohol, it is better for her to do the alcohol detoxification in a medical setting. So this is the completion of where she's going to be treated. If she wants to do detoxification, this should be done in a medical facility. Now the investigations, this lady must do a lot of investigations in order to understand more about her physical condition like liver function, kidney function, etc. Okay. Now we are going to talk about the plan, which will cover all her needs, psychological, physical, and social. Regarding her physical condition, it is very important to talk about her physical condition because it is already given to you in the beginning that she has a problem in her liver. You will liaise with the GP, you will discuss her physical needs in light of her past medical history and the investigation results. Now, please, when you talk now about the medications which you are going to offer for a patient who has dementia, you must put with this offer how we are going to sort out the problem of her memory, because you must talk, you are going to give her medications, but she is forgetful. So whenever you are going to talk about a medication given to a patient who has dementia, you must offer a solution for the memory problem. Otherwise, you do not do anything. She will forget the medications. So talk about the Z box or drug patches. In addition, there will be a nurse who will follow up her physical and mental condition to make sure that she's taking her medications. Okay. Now, very important to talk about the social services, which will do care assessment and will formulate a care package. And because of the high risk, it is important that she or the nearest kin to inform the DVLA. Okay, if this is not possible, the social services can help in this issue. Now pay attention, because I've been informed that you cannot intervene with the patient's personal life and go and inform the DVLA. It is the function or the job of the patient or the nearest kin. If this is not feasible, then the social services can take place. And our usual termination, giving him leaflets and so on. So this is how you address all the questions which you are going to get in this station. I hope that you found it helpful. I will not go through the mark sheet again in order to save time. Okay, thank you so much, Dr. Alex.
Thank you.
I hope that you found it helpful. So I would like to go next.
Okay, doctor. Okay, doctor.
So what is your station now?
Vascular dementia.
Vascular dementia. Okay. Okay.
Okay, doctor. How
Ready?
can I help you?
Let's say that my name is Michael.
Okay.
Michael.
And your father's name?
Abu Michael. Mr.
Abu Michael.
Mr. Okay, let's say that his name is Mr. Brown and I'm Michael. 1, 2, 3.
Okay. Good afternoon, Michael. I'm Damiana, a doctor of mental health team. How are you doing?
Well, I'm fine, but I'm worried about my father. He's very forgetful, and I want to know what's the problem.
Yeah, I'm here today to talk with you about the diagnosis of Mr. Brown and to see how we can go forward later on in a way that helps him. Is that okay for you?
Yeah, no problem.
Yeah. So you told me that he's found to be forgetful in the recent period of time. Do you notice anything else? I need to share with me your understanding about Mr. Brown's condition.
No, well, he's very forgetful, and we brought him. They said that they need to do some brain scanning, and I'm supposed to know more about the results of this brain scan from you.
Yeah, I'm gonna to explain for you the results of the brain scan. After proper assessment of Mr. Brown and doing the lab investigations and doing the imaging of the brain, it sounds that there is some blocked vessels which lead to decrease in the blood supply of the brain, which may be responsible for this memory problem, what we call most probably a vascular dementia. Did you come across this term before?
What is this? What do you mean by vascular dementia?
Yeah, the dementia is an umbrella term which describes a decrease in the brain function, including the memory and other brain function and thinking skills as well, to the point that affect the person's ability to do day-to-day activity. And it's vascular because it sounds to be related to the amount of blood reached to the brain to perform its function. Am I clear so far?
Yes. So what can be the cause of this vascular dementia?
Actually, we cannot detect an exact cause, but most probably it caused due to people who are exposed to stroke. And this stroke is caused mainly by many factors like people who have diabetes, hypertension, or have high body fats. They are all risk factors which predispose later on to stroke, and stroke leads to vascular dementia.
Well, is it common, doctor?
Yeah, it's quite common. It's the second common cause of dementia after Alzheimer's disease.
I see. So is it curable? Is it curable?
Unfortunately, dementia is a progressive condition, but what we will do is to slow this progression to have a better outcome later on. So it's okay for you to talk about how we can proceed later on.
I see, doctor. So how can you help him, doctor?
Yeah, usually we work as a team and we have many options of the treatment, the medications part, the psychological treatment, and the social part as well. But before talking about that, I need to double check with you about some points, if you don't mind.
Okay.
Yeah, could you tell me if Mr. Brown is treated for any medical condition?
Yeah, he has high blood pressure. He has high blood pressure. He has many heart problems also.
Mm-hmm. And he is on medication at the moment.
Yes, he's taking medication.
Okay. And did he visit a psychiatrist due to any mental illness? By any chance he drank alcohol?
No.
Or taking illicit drugs?
No.
What about smoking?
Yes, he smokes. Yeah.
Yeah, he smokes. Okay. And with whom he lives at the moment?
Well, he is living with me and my wife, but sometimes we are not able to take care of him because we are both at work.
Mm-hmm. Do you have any concerns about his safety?
Like what?
Like falls, for example, any movement problem, any fires?
No.
Is he eating well, sleep well?
Yes, he is eating well.
Mm-hmm. He is driving?
No.
He is able to manage his finance?
No, he's very forgetful. We stopped allowing him to take care of any financial issue.
Mm-hmm. Thank you, Michael, for sharing me this information. I need to highlight some important points that sound from our talking that Mr. Brown struggled with vascular dementia. It sounds he struggled with some medical problems. with no past history of mental health problem, which is good. He is a smoker, and we should consider that. He is living with you, but it sounds that you are not able to provide him with the proper care he needs at the moment. I'm going to discuss with you how we can go forward later on. As I have just mentioned for you, we work as a team. If we are about to talk about the medications, we have firstly to do some blood tests to be sure that everything is under control, to check about his blood sugar, his body fats, to check about his heart condition as well, to be sure that they are controlled under the medication, and to revise his medication as well to be sure that everything is under control.
I see.
Is that okay for you?
Yeah, yes, yes.
Yeah, about the psychological part, we need to arrange for meeting with the family to make what's called psychoeducation for the family about what is the vascular dementia and what kind of support they can provide Mr. Brown with, and about some issues we can do
1 minute remaining.
Behavioral. Is that okay?
Yeah, I heard that there are some anti-dementia drugs which can help them.
Unfortunately, the study didn't show that the anti-dementia drugs will be helpful in cases of vascular dementia, but otherwise the medication which help to decrease the risk of other stroke will be helpful in this situation. But I just want to ask you if he forget to take his medication sometimes.
Well, he's very forgetful now.
So we can consider some issues like dosage boxes or something that can remind him with the medication. We can get input from the social services and the community health teams, which help him for regular visits to be sure that he is receiving care. A very important part is a place of receiving the treatment. We can consider transferring him to other place where he can receive the treatment if it's difficult for you to provide him with the proper care. I know that it's a difficult task, so we can provide you with a carer support as well. How do you think about that?
Well, sounds helpful. Time. How do you feel about what you did?
I tried to do my best. I don't know.
It was good, by the way. It was not bad, but pay attention to some details related to the management. That's it. But it was very good, actually. It was very good, and the formulation was good. But the best thing, as I always say, let's see how we can do it. Sorry, my daughter is annoying. Okay. Okay. The first thing, you introduce yourself, as I always say, and please, when you practice with your colleagues the last time, please don't forget to practice how to introduce yourself and show empathy. And you did explain, then you explained to him his main query. What is the problem? This man is having vascular dementia. He explained it in a very good way that it is what is dementia and why it is vascular. The cause of vascular dementia, you did address it. Is it common? I don't like saying the second or the third. Let's say it is very common and can be up to 20% of the patients who are suffering from dementia. Okay. Is it curable? Unfortunately, it's not curable. And you can add the cherry on top that the lifespan of the patients ranges from between 4 to 8 years after the diagnosis. And the medical support can only decrease the rate of deterioration to improve the quality of life for the patient and to help the caregivers in taking care of the patients. So this is the main role of the medical treatment. How can we help him? You gathered the right information, but there are some more important information we should know. You want to know more whether he is depressed or no. It is very common that patients who have vascular dementia to have depression. Pay attention to this. You ask about his sleep and appetite. You ask about his physical condition. You ask about his social circumstances, you ask about the level of risk, everything is fine, and then you did your formulation, it's very good. But the problem is that you did not chunk and check. Please, after formulation, ask him if there are any other points which he would like to discuss. Now, again, doctors, in the last 90 seconds, you only have 90 seconds to talk about your management plan. You should be very organized, and this is how I organize my presentation for talking about the technical points in the last 90 seconds. So what you are going to do is that you talk about what are you going to do, Dr. Demiana. Okay, it's definitely you want to see the patient yourself. You want to explain to him his diagnosis, the management plan, and address his concerns. Okay, so this is what you are going to do. And where the patient is going to be treated, ideally he should be treated at home. However, if his needs are not met and there is high risk, admission to a nursing home can be considered, or a care package can be given to him at home. Are with me, doctor? Now, investigations. The second point which you are going to talk about is the investigations. What are the investigations which you need to do to him? Because definitely there are investigations which should be done for this patient before, because you might need to give him medications. You will double check the investigations, particularly the heart tracing, liver function, kidney functions, and blood chemistry. So, and then talk about the plan which will cover all his needs physically, psychologically, and socially. And please articulate this sentence. There will be a plan which will cover all his needs physically, psychologically, and socially. Physically, there is a big magnitude here in the management plan for the physical approach or for the physical care of this patient, because this patient is already having medical problems. So you are going to liaise with the GP and explain the diagnosis. And because the patients who have vascular dementia are basically managed by optimizing their general condition, like the blood sugar level and blood pressure and kidney functions. That's why it is very important to liaise with the GP. So this is the first thing which you should talk about, that you are going to make sure that his physical condition is fit. Okay. Number two, if you just want to show that you are professional, there is no place for the medications here except that he might suffer from depression, which is not uncommon. And in this case, we should avoid the anticholinergic, the tricyclics, because they decrease the level of acetylcholine, which is the chemical substance in the brain responsible for the memory. Okay, the best medications for this group of patients is the SSRI, and the tricyclic medications should be avoided. Psychologically, also, there can be some activities to improve the qualities of life, like reminiscent therapy, music therapy, and pet therapy. Socially, it is very important to talk about how you are going to implement the social services. The social services are going to do care assessment, and also are going to formulate a care package. And also there can be a role for the occupational therapist to make sure that the patient's home is safe for him, because most probably those who have vascular dementia also have a problem in their movement, because sometimes the vascular problems can reach the motor areas. Okay, are you with me, doctor, so far? And finally, tell me, so this is how we talk about the management. Apart from the technical parts of the management, your approach was very good. So it's everything was good in your management. Everything in your management was good, except that the technical points. Okay.
Okay.
Thank you so much, Dr. Demian. Who would like to go next? I think we have finished.
Can I do serotonin syndrome? Has it been done?
Serotonin syndrome. Okay. Did you prepare it? Did you put your name beside the station?
Yeah, Imam apologized for doing it because he's in work.
Okay, no problem.
Anyway, I think historically the mood so that include the following is that papyrus is there. At least another one. Aristotle should not be there.
Ishaq, could you mute yourself, Ishaq, please?
What did you say?
There's someone unmuted, so it's, there's background.
Any about ads with
Okay, I'm ready. What is his mom name?
I say that is my Mrs. Green. 1, 2, 3, go.
Hi, Mrs. Green. This is Dr. Yunus. I'm one of the doctors in the mental health liaison team. I understand that you are here for your son, Robin, and I understand that you have some concern, and I'm here to answer all your questions.
Well, doctor, I don't know what's wrong with him. They said that he is in the intensive care units, and I want to know exactly why is he in the intensive care unit?
Yeah, I totally understand your concern and worries about your son. I have little information about what has happened at home. My understanding is that the consultant started him, the psychiatric consultant started him on a medication for his depression. Can I just take a bit of information from you to understand what is going with him?
Okay, no problem.
So, how did you come here today? What was happening at home?
I came by taxi. What do you want to know?
What was happening at home? Why you came here to the hospital?
I came here because they said that my son is in the intensive care unit. So I want to know why is he in the intensive care unit?
All right. I mean, have you been living with him in the same home?
Yes. He has depression and he took some medications. We brought him here and they said that he must go to the intensive care unit, and I want to know why.
Yeah. So how was he at home before coming here?
Well, he had depression. He has been taking medications for depression, and that's it.
Do you know what medication he was taking?
He was taking fluoxetine, something like this, and then the doctor changed it to another medication. I think it's something called Venlafax and something like this.
From your understanding, is there any possibility that he might have taken more than he should take, either by accidentally or intentionally?
I don't know, doctor. I don't know.
All right. And is he taking any other medication?
Yes, he is taking a medication for pain called tramadol because he is a football player and he had an injury, and he is taking this medication to decrease the pain.
All right. So he also has tramadol, which is, I believe, from the point of view we are seeing him today, is significant, and I will discuss later on. But what was the symptoms he was showing? Why you brought him to the hospital, to the emergency care?
I felt he was a bit confused, and I felt that he is not okay. So I brought him here. That's it. But this, I thought that it would be something mild, but they said that you must take him to the intensive care unit.
Yeah. Thank you for sharing this information with me. I totally understand your concerns and worries about Robin. And I believe from the information that you have told me, with the recent change of the medication, and also he's taken of his antidepressant, and he's also taken tramadol for back pain. Robin has presented with high temperature, confusion, muscle rigidity. Usually these constellation of symptoms in a context of what's called serotonin syndrome. Have you ever heard about this before?
No, what is serotonin syndrome?
So serotonin is one of the chemical substance. You know, the brain is the master organ, and the serotonin is involved in many organ function that the brain try to control other body organ function, like the temperature, the blood pressure, the heart rate, and also serotonin is known as the happiness hormone. It has a significant effect in people, on how people feel in their mood, and it is related also to an anxiety disorder. From what you told me, that he was taking antidepressant, venlafaxine. Venlafaxine is one of the medication that help depression by improving the level of serotonin in brain, increasing the serotonin in brain. And you know, sometimes if it is taken with other medication that might increase the serotonin level, this can lead the serotonin to be very high and to reach to a toxic level and lead to these symptoms that Robin presented with before coming to the hospital. Am I clear so far?
Is it a serious condition?
It could be serious condition if it is not detected early. Fortunately, he has not taken much of his medication. It was just started very recently, and he is in a safe place here. The first thing that we'll do, we will stop the medication that increases the serotonin, including tramadol and venlafaxine. And usually
but are you sure, doctor, that it is a serotonin syndrome? Could it be something else?
There is always a possibility that it could be something else, but from what you have told me, this is the most this is our most concern at the moment. We can also screen him for other things that cause this problem. There might be a brain infection or something, so I'm sure that the intensive care staff will do the necessary investigations. There is also other complication.
How is he doing now? 1 minute remaining. How is he doing now?
So I need to see the vital signs of his vital signs, but I believe he's in a safe place at the moment. We are managing his condition, and we are giving him supportive treatment to manage his condition, like muscle relaxant to decrease the stiffness in the muscle. We're decreasing his temperature by giving him medication to decrease temperature, like paracetamol, and we're making sure that to support his organ functions, and everything will be all right.
Will there be any permanent damage to his health?
Most probably there will not be. We hope for the best. It is very difficult to answer this question at the moment, but most people who have this condition and who are detected early have a very good prognosis.
Okay.
Do you have any other question?
No, thank you.
Thank you very much. I understand that it is very, very unfortunate that what happened to him, and it's very worrying, and we are here to support you and him.
Okay, thank you. How do you feel about what you did?
I felt in the start, Dr. Hussam, you was not giving enough information. I came here by a taxi, and I tried to explore.
You asked me why did you come? How did you come? Your question was strange. How did you come? Why? Pay attention to your questions. I answered your question. Because
Yeah, but I asked it many times in the same way.
an answer to your straight. How did you come? I came by taxi. So what do you expect me to say? How did you come? So this is the typical answers.
Yeah, but I
But
asked it, what was happening. You mentioned he has depression. Yeah, what was happening before he come to the hospital? I mean, yeah. Anyway, I lost some time because, like you said, maybe because my framing of questions was not the most appropriate. So I have lost some time in exploring what was going on initially. I believe I tried to rule out any other like any overdose or unintentional, whether it is intentional or unintentional. I tried to explore the circumstances of what happened. I believe I tried to be empathetic, to understand the mother's situation. It is a very difficult situation and so on.
Okay, so let's see according to our PDF. Okay, you must show empathy in this particular station because she's going to express her worries. It is a challenge to your communication skills because her son is in the intensive care unit, so pay attention to this. You must also take good drug history, very important, take good, which you did, by the way, and the bit of information which most of the candidates do not pay attention to, that this man or this patient is also taking tramadol, which acts also on the serotonin system, which adds to the risk of developing serotonin syndrome. So introduce yourself, what is wrong with my son, why he is admitted, explain. You have two courses, either you explain the serotonin syndrome to her or you start gathering the biopsychosocial information and risk according to the flow of information, okay? So again, this is a consultation skill, not because the flow of the conversation is not like what you have practiced, you will be perplexed. Make sure that you address the concerns of the patient, and by signposting, you go to your main course as what you have practiced. Here, I was just giving you the lead, what's wrong, and I did not insist on particular thing. So you start by gathering the biopsychosocial information, and then you explain the serotonin syndrome. It was good. Okay, no problem with your explanation. Why did he get this serotonin syndrome? Most probably it is from the medications. He is taking many medications which are working on serotonin syndrome in addition to the tramadol, okay? Is it a serious, unfortunately, condition? Yes, up to 1%. There is a fatalities from this serious syndrome. That's why he is in the intensive care unit. Do not duck and avoid talking about this serious side effect. Could it be something else? Yes, there could be another possibilities. Like what? Like neuroleptic malignant syndrome, meningitis. However, the symptoms in them take time to appear, and we rule them out by investigations. How he is doing now? Your answer is typical, and I hope that all the candidates pay attention to this. You will have a chair in the read. You are going to Sheffield, inshallah, and you will find that there is a piece of paper attached to the chair, and in this, it is a big green paper, and in this piece of paper, the vital data of the patient will be present, okay? And according to this vital data, you're going to give her an answer to how he is doing now. She wants to know how he is doing, her son, not the general idea or the general scientific information of the patients who have serotonin syndrome. And again, this is a mistake which the candidates do. They just talk generally about the patients who have serotonin syndrome and ignore that she wants to know exactly how her son is doing, and the information you have it in this piece of paper attached to the chair. How long does the serotonin syndrome last? Most probably around 48 hours. Is he in pain? Again, all these questions are the questions which you are going to get in this station. It's not painful. However, it seriously affects the vital functions of the patient. Whether any permanent damage, again, we said there is no permanent damage. And then the formulation, do the formulation as much as you can. I'm not going to go through it. You can see it according in my YouTube channel. So the management.
So can we say here, with regard to formulation, can we say, so Robin is a 24-year-old?
No, so the first thing you are mentioning historical details, which just mention what is the main psychological problem and the level of risk.
I'm not saying any historical details. I'm saying it's 24-year-old. This is not historical.
This is a historical detail. There is no need. Formulation, you are picking up the most important piece of information, which you'll build on it, your management plan.
He's now 24-year-old, not the past year. He's now 24-year-old.
Okay, if you insist. Okay, if you insist on saying this, okay, go ahead. Go ahead.
So Robin is a 24-year-old who has history of depression that didn't respond to fluoxetine, and he has recently started on venlafaxine. However,
again, these are historical details. The main psychological problem here is that he has depression and he has serotonin syndrome. You are reciting what happened. This is not formulation. So again, you are not able to grasp what is the formulation. What is the problem now? The problem is not that he is 24 years old or he's taking medications for depression. The problem is that he has depression and he has serotonin syndrome.
Can we say Robin as a 24-year-old who is presenting with serotonin syndrome on top of a side effect of combination of medication that increase the level of serotonin?
Side effect of medications, exactly, of depression, yes, that's good. Okay, and there is high risk. So this is how you talk about, this is the first line. The main problem, serotonin syndrome, because of side effect of antidepressant medications. And then the second line, the background information which you know or you need to know. Okay, the biopsychosocial information is also taking tramadol. Okay, and there is no other physical problems, etc. Okay. The management. What are you going to do? You, Dr. Ayman, what are you going to do and where the patient is going to be treated? He is going to be treated in the intensive care unit, and you will liaise with the physician and you will update her with the condition of the patient. So this is how you start talking about the management plan. What are you going to do and where the patient is going to be treated? The investigations, he need to do some blood tests, the routine, but you must verbalize and articulate what are these routine blood tests. Number 3, there will be a team which will follow him up, and so on. So regarding the medications, the backbone of the treatment is to stabilize his vital functions and stop the offending medications like tramadol and the venlafaxine. The high temperature will be controlled by cooling blankets, and we will control the blood pressure. And also there is a role for a particular medication which can control the level of serotonin, like cyproheptadine. Okay. Regarding the psychological part, if there is any agitation, which is not uncommon with the patients who have serotonin syndrome, use benzodiazepines to stabilize his mental state. And once his mental state and physical condition are stable, he is going to be transferred to psychiatric side, and you must document the serotonin syndrome. Okay, very important to do so. And start him on other medications which are less liable to cause serotonin syndrome, like mirtazapine and bupropion. Show the examiner that you know exactly and professionally as a member of Royal College what to do and what are the medications which can be used in this condition, like cyproheptadine, mirtazapine, bupropion, and so on. Make your answer different from the other candidates in order to be more distinguished, and this will give you an edge and a chance to pass. I hope that you found it helpful, Dr. Ayman. Okay. So who would like to go next?
It was very nice. Thank you, Dr. Hassan. Thank you.
So who would like to go next, please? I think we have finished. Okay. Good luck. I hope to see all your names in the pass list. Please not less than 4 to 5 stations daily, on daily basis. Preparation with your colleagues. Have a good night. Bye-bye.